The hospital didn't feel dangerous. That was the problem. White walls, soft lighting, voices trained to sound calm even when delivering bad news. Everything about St. Hilaris Medical Center suggested control, not chaos. Marek Solon trusted it immediately. He had been admitted for something minor, persistent dizziness, nothing dramatic, the kind of thing doctors like to monitor just in case. One night turned into 2, then 3. The tests kept coming back normal. That should have been reassuring. Instead, it made things stranger. Sometimes the body hides things, the attending physician said gently. We prefer to be thorough. Thorough was a comforting word. Marek didn't argue. The ward was quiet, almost peaceful. Nurses moved efficiently, always polite, always attentive. They remembered his name, his preferences, how he took his tea. Someone was always nearby. 2 nearby. Marek noticed it on the 4th day. Every time he tried to leave the room, just to walk the corridor, a nurse appeared. Are you feeling steady? Let me help you. You should rest. None of it sounded like restriction. It sounded like care. His phone still worked. No one took it, but the signal was weak. Calls dropped often. Visitors were limited due to protocol. Marek's sister tried to come by. She was told visiting hours had ended early. He didn't question it. Hospitals had rules. On the 5th day, Marek overheard a conversation outside his room. Not about him, about another patient. Non-compliant, a voice said quietly. Anxiety-driven. Potentially disruptive. The words didn't sound medical. They sounded administrative. That evening, Marek asked a simple question. How long will I be here? The doctor smiled. That depends on how cooperative your recovery is. Cooperative. Marek frowned. Recovery isn't a choice. The doctor's smile didn't change. Everything here works better when patients work with us, she said. That night, Marek couldn't sleep. Not because of pain, because he realized something unsettling. No one had explained what would count as enough. Enough improvement, enough stability, enough compliance. Tests were normal. Vitals were steady. Yet nothing moved forward. The next morning, Marek was told his room would be changed. No reason given. The new room was deeper in the ward. Fewer windows. Quieter. A nurse adjusted his IV and spoke softly. Some patients need a calmer environment, she said. It helps them accept care. Accept. Marek lay back against the pillow, heart beating faster now. He wasn't afraid of being sick. He was afraid of something else. That in St. Hilaris, leaving wasn't about getting better. It was about being easy. And Marek had the uncomfortable sense that the hospital was already deciding how easy he was going to be. Marek began noticing the language first. Not the diagnoses, the phrasing. Nurses didn't say aloud. They said recommended. Doctors didn't say required. They said helpful. Everything was framed as guidance. Choice-shaped. But every choice had a correct answer. When Marek asked for a walk without assistance, the nurse smiled. Of course, she said, if you feel stable. Stability again. He stood up. The dizziness was gone. Had been for days. Still, the nurse hovered close enough to touch him. In the corridor, Marek noticed the doors. Some rooms had numbers. Others had colors. Blue tags, yellow tags, red tags. No legend, no explanation. Patients in blue tag rooms walked freely. Some even wore their own clothes. Yellow tag patients moved only with staff. Red tag rooms were quieter, shades drawn, doors half closed. Marek's new room had a yellow tag. He asked a nurse what the colors meant. She didn't answer directly. "They help us respond appropriately," she said. "Different patients need different levels of structure." Structure. That word followed him. Later that day, Marek overheard a nurse station conversation. "Room 612 is cooperative," one voice said. "Low distress," another replied. "Good candidate for discharge once cleared." Then, "Room 619 is resistant. Escalates questions. Recommend extended observation." Marek realized something with a jolt. Those weren't symptoms. They were behaviors. That evening, a man in the next room tried to leave. Not aggressively. He just insisted he felt fine and wanted to go home. The staff responded calmly. Too calmly. They asked him to sit, brought him water, spoke in reassuring tones. Security never appeared. They didn't need to. The man's voice grew louder, then softer, then tired. By morning, his room had a red tag. Marek didn't see him again. On the 7th day, Marek was assigned a patient liaison, a woman named Elira. She wore no medical badge, just a neutral one. Her job, she explained, was to support the patient experience. She asked Marek questions no doctor had. "How do you feel about authority? What makes you anxious? Do you feel the need to control outcomes?" Marek laughed once, then stopped, because Elira was writing everything down. "This isn't therapy," Marek said carefully. Elira smiled. "No, it's alignment." Alignment. The same word Daniel had heard in another building, in another life. Elira explained that St. Hilaris believed recovery depended on trust. "Patients who trust the process recover faster," she said. "Those who resist often experience complications." "Medical complications?" Marek asked. Elira paused. "Situational ones," she replied. That night, Marek searched his patient portal. Test results were still normal, vitals stable, no clinical reason to stay. But there was a new note. Patient displays anticipatory anxiety. Recommend continued observation. Anticipatory of what? Marek requested discharge formally the next morning. The request was acknowledged, not approved. He was told to wait for a review. Hours passed. No one came. When Marek pressed the call button, a nurse arrived quickly. Concerned. "Are you feeling distressed?" she asked. "No," Marek said. "I want to leave." The nurse nodded slowly. "Let's talk about what's making you feel unsafe," she said. Unsafe. The word was inverted now. Leaving was framed as danger, staying as protection. That afternoon, Marek's room was changed again. Deeper still. No tag this time. Just a small sign by the door. Observation in progress. Marek sat on the bed, heart pounding, because he finally understood. St. Hilaris didn't hold people because they were sick. It held them because they weren't compliant yet. And compliance here wasn't agreement. It was silence. Marek met Tomas by accident, or at least that's how it was framed. They crossed paths in the corridor late at night, when the ward felt thinner, less supervised. Tomas was older, thin to the point of fragility, wearing his hospital bracelet loose around his wrist like he wanted it to fall off. They exchanged a glance. Not curiosity. Recognition. "You're still asking questions," Tomas said quietly, without introduction. Marek hesitated. "I just want to leave." Tomas nodded. "So did I." They sat together in a small waiting alcove near the elevators. No staff in sight. The first place Marek had felt unobserved in days. "How long have you been here?" Marek asked. Tomas smiled faintly. "Longer than my diagnosis." That sentence settled heavily between them. Tomas explained in fragments, as if he had learned not to speak in complete narratives. He had come in for chest pain, mild, precautionary, tests normal. But he asked too many questions early, requested copies of reports, asked why procedures changed without explanation. They marked me as anxious, Tomas said, then resistant. Marek asked, "Why didn't you just agree?" Tomas looked at him carefully. "I did," he said. "Eventually." That was when Tomas showed Marek his chart. Not the medical one, the behavioral one. He had taken a photo weeks ago, before they restricted phone access further. It listed things Marek recognized now. Escalation tendency, authority challenge, low deference to reassurance. At the bottom, a note. Extended observation recommended to reduce patient-driven disruption. "This isn't treatment," Marek whispered. Tomas shook his head. "It's containment." Tomas told him the hardest part wasn't being kept. It was being corrected. Every time he showed frustration, it was documented as instability. Every attempt to assert autonomy was reframed as anxiety. "So I learned," Tomas said quietly. "I stopped asking, stopped reacting, stopped pushing." Marek asked the question he was afraid of. "Did it work?" Tomas didn't answer immediately. Then, "They stopped watching me so closely." That wasn't discharge. That was relief from scrutiny. The next morning, Tomas was gone. No warning, no goodbye. Marek asked a nurse casually where Tomas had been transferred. The nurse checked her tablet. "There is no patient by that name in this ward," she said. Marek's stomach dropped. "But he was here last night." The nurse smiled politely. "Sometimes stress affects perception." Perception. Reality was becoming optional here. That afternoon, Marek was called into a review. 3 people sat across from him. A physician, a liaison, someone Marek hadn't seen before. They spoke softly. They praised his progress. Then they mentioned Tomas, not by name. "As you've seen," the liaison said, "patients who resist care often struggle longer. Those who accept guidance move forward." "Where did he go?" Marek asked. The physician folded her hands. "He was transferred to a facility better suited to his needs." "What needs?" Marek pressed. The room cooled slightly. "Safety," the physician replied. That night, Marek understood the final layer. St. Hilaris didn't threaten patients. It demonstrated consequences, quietly, indirectly. Tomas hadn't been punished. He had been removed from comparison, a living example erased before it could become a question. Marek lay awake, staring at the ceiling, because now he knew the rules completely. You didn't get discharged for getting better. You got discharged for becoming easy, and if you refused, St. Hilaris wouldn't argue with you. It would simply move you somewhere no one else could see. Marek stopped resisting, not because he believed them, because he understood the math. Every question added days. Every objection added notes. Every attempt to assert control was logged as evidence that he wasn't ready yet. So he changed. He smiled more, nodded sooner, thanked nurses for things he didn't need. The staff noticed immediately. His chart changed tone. Patient appears calmer, improved cooperation, reduced distress behaviors. None of that had anything to do with his body. His discharge meeting was scheduled 2 days later. No celebration, no relief. Just procedure. The liaison smiled warmly. "You've made excellent progress," she said. "You're demonstrating readiness." Readiness for what? Marek didn't ask. He had learned what questions did. On the morning of discharge, his phone signal returned fully. Messages flooded in. Missed calls from his sister. Emails unanswered for days. A life paused outside these walls. As he dressed, Marek noticed something small but unsettling. The door to his room didn't click when he opened it. It hadn't been locked. It never had. That realization stayed with him as he walked down the corridor, past blue tags, past yellow ones, past rooms with doors half closed and curtains drawn. He wondered how many of those patients were getting better, and how many were just getting quieter. At the exit, the same woman who had first admitted him handed back his belongings. "Take care of yourself," she said kindly. Marek nodded. Outside, the air felt sharper than he remembered. Too real. For days afterward, Marek noticed the hospital hadn't really let go. Not legally, not physically, internally. He flinched when doctors spoke quickly, apologized automatically when asking questions, waited for permission that no longer existed. At a follow-up appointment elsewhere, a physician asked him a routine question. "Do you feel safe at home?" Marek answered without thinking. "Yes," then paused, because the word felt wrong. Safe had come to mean compliant. Weeks later, Marek searched for St. Hilaris online. No scandals, no investigations, high patient satisfaction, testimonials praised calmness, efficiency, professionalism. One line appeared again and again. "They really listen to you." Marek understood now why that was true. They listened carefully. They categorized, adjusted, responded. And when listening wasn't enough, they changed the environment until the patient changed themselves. Months later, Marek received a survey in the mail, printed, anonymous. "How supported did you feel during your stay?" He stared at it for a long time, then checked the final page. "Would you recommend St. Hilaris to others?" Marek set the paper down. He thought of Tomas, of red tag rooms, of how easily concern became justification. He left the survey blank, because the final truth had settled into him slowly, like a diagnosis you don't want but can't ignore. St. Hilaris didn't hurt people. It didn't imprison them. It didn't threaten. It did something far more effective. It taught them that cooperation felt like freedom, and by the time you walked out, you weren't sure which parts of you had healed, and which parts had simply learned to stop fighting. Marek folded the survey and threw it away, then sat quietly, listening to his own breathing, not to check if it was normal, but to remind himself that outside those walls, silence no longer meant approval, and that was the hardest thing to unlearn.